My name is Jaime Estremera Fitzgerald, and I'm the CEO of your Aging and Disability Resource Center, which is also your local area agency on aging.
I'm Don Chester. I'm an assistant administrator at St. Mary's Medical Center and the Palm Beach Children's Hospital.
Robin Lee, CEO of Wellington Regional Medical Center.
I'm Mitch Feldman. I'm the CEO at West Boca Medical Center.
I'm very excited that we truly are the gateway for all services and supports for seniors, caregivers, and adults with disabilities in a 5-county area.
One of my responsibilities at St. Mary's is community relations, and I have the privilege of working with many not-for-profit organizations and with many government organizations to help develop and provide programs that will help the community's health.
We're a 233-bed hospital located in the Western community that serves as a teaching hospital and the only Level 3 NICU in our community.
West Boca Medical Center is your classic community hospital servicing the residents of Boca Raton and the southwestern part of Palm Beach County.
One of the most exciting parts of our agency is our helpline. Every day my staff help people that they can't find answers anywhere in the community. They call my staff, they get connected with the answers to their problems. Recently, a young lady called me about her aunt. She'd been searching for over a year to get her aunt help to be able to stay at home as long as she could. She was able to get that. She called me. She wanted me to know how grateful she was because she had been looking for so long. I am grateful for my staff every day, and we as a community need to be grateful for what the helpline is able to do every day.
In 1988, I was a member of a committee that helped encourage the voters of Palm Beach County to pass the healthcare district. A major reason that district was passed is the trauma system. It started in 1991 at St. Mary's Medical Center, and thanks to that trauma center, my life was saved in 2004 after I was severely injured in an automobile accident and I was hit by a car. Since then and before then, that system has saved thousands and thousands of lives.
We're so excited to be nominated for this award because we believe it validates that putting the patient in the center of everything that we do, every patient, every time, is the key to a successful organization.
It's been my great privilege to be a hospital CEO in this community for over 20 years. And during that time, we've worked with a lot of different groups, other hospitals, and other health organizations to advance and promote new services in a quality fashion in Palm Beach County. Servicing somebody in their time of need when they have a health crisis and having them come out of it with restoration of their functionality and leading a productive life is just a very satisfying feeling. So to me, that's what it's all about as a healthcare executive.
I'm Roy Foster. I'm with the Stand Down House located in Lake Worth, Florida.
I'm Michelle Gonzalez with Healthy Mothers, Healthy Babies Coalition of Palm Beach County.
I'm Barbara Boyd-Floring. I'm with the Arthritis Foundation Clinics in West Palm Beach.
I'm Gary Peters, President of the Board of Directors of Boca Helping Hands, a family resource center.
My organization provides service for veterans with substance abuse, homelessness, as well as many other services that are needed.
Our organization works with pregnant women and teens all over Palm Beach County to improve birth outcomes to ensure that they have healthy babies.
We provide medical services for patients with arthritis-related diseases.
Our organization offers hot meals, backpack programs for children throughout the school year, job training, job mentoring, and most recently, we opened a medical center.
I love what I do each day because it gives me the courage and strength to see and empower our veterans to move forward and reuniting them with their families to be a powerful part of this community.
For us, what's most important is the number of women we serve throughout the community, the kinds of women we serve every day. Just recently, we had a 24-year-old young woman come into our offices who is homeless and living in her car. She's 7 months pregnant and hasn't seen a doctor yet. So it's our job to become her advocate. It's our job to ensure that she has every possible resource in this community to deliver a healthy baby.
When I came to the Arthritis Foundation clinics, I did not realize the overwhelming need that was in the community Now that I am part of the clinics and I provide service to hundreds of people every year, I realize the enormous need, and I'm very proud to be a part of the clinics and helping these people get the medical attention they need and also the love and support that we give to them.
What introduced me to Boca Helping Hands was Hurricane Wilma, which devastated so many families in the Palm Beach area. And I found after 40 years on Wall Street that I could join an organization made up of 400 volunteers that are trying to serve the needs of those families that are hurting during our economic recession, as well as through underemployment even today. We've added not only food to the resources at Boca Helping Hands, but we've added job training, job placement, and we've had great success in getting people actually out of the food line and into being employed.
I'm Bernardo Besso, Associate Professor of Medicine at Florida Atlantic University Charles E. Smith College of Medicine.
I'm Gauri Agarwal. I'm the Associate Regional Dean for Medical Curriculum for the University of Miami Miller School of Medicine.
My name is Marta Galvez. I'm the Medical Sciences teacher and coordinator for Lake Worth Middle School through the Biomedical FAU program.
I'm Dr. Mark Brody. I'm a neurologist and the Director of Brain Matters Research in Delray Beach.
I have the honor to train the next generation of physicians at 3 different participating hospitals in our community.
My primary role is to have oversight of the clinical education of the 100 medical students that are predominantly up here in Palm Beach County doing all of their clinical clerkships.
Our program is to educate students who are interested in the medical sciences healthcare.
My institute specializes in the diagnosis, treatment, and research of Alzheimer's disease.
Over the past 18 years, I have the opportunity to work with many resident physicians. But the most rewarding part of our experience is when that light goes on and you're able to see it through their eyes and enjoy with them the realization that they're ready to work with the community.
Our ultimate goal as healthcare educators is not to just teach them about the algorithms and the steps and all the medications that you need to treat a heart attack, but how to actually convince your patients to take those medicines and how to develop relationships with them so that they come back to continue to seek care. And to me, that's really what I love in education, is that you can not only graduate physicians who are incredibly knowledgeable and skillful, but who maintain their humanism and that connection to why we ultimately do what we're doing, which is to be empathic people who are improving people's lives.
I have passion for medicine and kids. Now to put those together for me is like we have the best gift in life, because what we do for those kids, nobody's gonna take that away from them, no matter if they will continue in the medical healthcare or if they follow up another dreams in life.
Alzheimer's is a devastating disease without any dignity. Everybody gets worse, everybody dies. My father has Alzheimer's, and I've been working with Alzheimer's patients for 20 years. I see the same thing, the progressive decline, the agony with the family. I'm experiencing it now with my family. So my mission is to educate people, find people at risk, and now the hope is that we can treat people before they have even symptoms and they'll never know what they missed. At Brain Matters Research, we give substance to hope.
My name is Christian Mosley. I'm a medical student at Florida Atlantic University.
I'm Patty McDonald. I'm the president and CEO of the Nicholas Children's Healthcare Foundation.
I devised a new synthesis for a chemotherapeutic used to treat the world's most lethal brain tumor, such that now every place that has a particle accelerator in the world can create this chemotherapeutic on site and can use it to image this brain tumor to see if their treatments are working. And that's important now because everybody in the world, instead of just a few select locations, can have access to research this brain tumor called glioblastoma.
The foundation is dedicated to bringing access to world-class healthcare for the children and families of the Palm Beach County community.
I got into science initially because I just found chemistry fascinating. Growing up, I was a huge nerd. I was into video games. I was into all the science fiction stuff. And chemistry just seemed to me the most important of the sciences that I could work with right off the bat. Chemistry is in everything, from the water we drink, the medicines we take, to the way we're built as humans. It's involved in everything. And I loved its ubiquitousness.
I feel so grateful to be able to work for the foundation. This is only the second job that I've had in my 30-year career here in Palm Beach County working for charities, but I look at this foundation and the work that I'm able to do, and I feel so blessed because when you can help a family stay in their community, in their backyard, and get the care that they need for their child, that makes a huge impact not only on the child, but the entire family. And so being able to be part of that has just been the most rewarding aspect of my entire career.
My name is Jane Miller, and I'm the CEO for Alliance for Kids.
I'm Feriala Andre. I'm the administrator and the owner of Regal Home Health and Care Management.
I'm Becky Diamond, and I am founder and president of Hepzibah House.
My name is Valerie Fiordolino, and I'm a physician assistant for the Cancer Center of South Florida.
My organization provides services for hospitalized children to reduce the trauma of their hospital experience.
We provide home health care services to the elderly in Palm Beach County, Martin County, and Broward County.
We run a restoration program for women coming out of human trafficking and commercial sexual exploitation.
I take care of cancer patients in the office and in the hospital every day.
I am most proud of the fact that we've been able to reduce the trauma for over 20,000 children. That's 20,000 children since 2012.
I'm grateful to have had the opportunity to serve the community, and I would hope that I'll be able to continue doing so for many years to come.
The objective at our organization is to restore hope and really to restore destiny. So many of the women that we work with have had their lives stolen in so many ways. One woman was sold when she was 14. She was in the life about 20 years. And when she came to us, very typical, she had no real ability to bond or to trust. And whole series of events went down, but that barrier got crossed just a few weeks ago. And that's really why I do what I do, why our organization and the volunteers that are involved do what they do, is to see people get a fresh start.
For me, this job is very personal. I became a physician assistant in oncology because my dad underwent 4 years of treatment for leukemia, and I lost him in 2009. And during that entire process, I knew I wanted to make my life dedicated to his memory and take care of patients the way they took care of him. And so my overall goal is to give the best care I possibly can to these patients and make this process as easy as possible for them and their families through the treatments, through remission, through the ups and the downs, and make it as easy as possible for them.
My name is Wilgis Smith-Stillion. I'm a senior at Inlet Grove Community High School in Riviera Beach.
My name is Andrea Wilson, and I'm a student at John A. Leonard High School in Green Acres, Florida, and I'm in the medical academy there.
I'm Andrew Quinlan. I'm a recent graduate of Florida State University, where I received my bachelor's degree with a biochemistry major and business minor.
I've been volunteering at Morse Life Geriatric Center, where I help the patients with rehab and just simply talking to them.
I'm also the president of the Health Occupation Students of America, which is a club for aspiring students to be in the medical profession?
Right now, I'm a clinical research coordinator at Brain Matters Research, where I screen patients, set up caregiver support groups, and also spread public awareness about Alzheimer's disease by giving lectures to the public.
2 years ago, I had a surgery on the left side of my brain that completely made my right side of my body limp. After I woke up, I started rehab immediately, and I saw how the therapists at St. Mary's interacted with the patients. They were kind, they were respectful of the patients. Because of that experience and my prior volunteering hours at Morse-Life Geriatric Center, it reinforced my desire to become a geriatrician in the future.
I was inspired to be in the medical field by many different reasons. The first being that my grandmother had dementia and my father had cancer, and just seeing how other people helped them really made me want to help people just like them. And another reason is how I saw through the Health Occupation Students of America, we did a toy drive, and in the toy drive people donated toys to us, and we got to distribute them to the St. Mary's Children's Hospital. And just seeing how grateful they were and delighted that we had made their day by bringing just a simple toy made me really happy and just passionate for the medical field.
I've been interested in medicine since I was young, and then in 2011, my grandmother passed away from Alzheimer's disease. That really solidified my decision to pursue and study neuroscience. At Brain Matters Research, we work every day to find a cure for Alzheimer's disease, and in the future, I hope to be a physician working in the medical field where I can cure many of these diseases.
My name is Julie Swindler. I'm the CEO of Families First of Palm Beach County.
I'm Eric Call. I'm the Director of Palm Beach County Parks and Recreation Department.
I'm Robert Parks. I'm with the Palm Beach County Health Department.
I'm Rita Thrasher. I'm President and CEO of Boca Raton's Promise, the Alliance for Youth.
And my name is Liliana Herrera. I work with the Area Agency on Aging in West Palm Beach, and my position right now is a project director of the Healthy Living Center of Excellence.
Among the many things that we do, we ensure that babies are born healthy.
For decades, my department has been responsible and been a leader in providing health and wellness opportunities for all citizens of Palm Beach County.
In working with the health department, my responsibility is to provide protection from diseases, promotion of health for 1.4 million people in Palm Beach County.
We work in education and awareness in the area of mental health. We work with educators and professionals so that we can start meaningful conversations between citizens of all ages in Palm Beach County.
My job is to work with the senior population in Palm Beach County and as well as the other 4 counties that we serve. We are approaching the senior community because of the fall prevention issues that exist as well as chronic disease self-management.
What brings me excitement over the past 26 years is knowing that we have served hundreds and thousands of families and their children and have brought hope for the future for so many lives.
I get excited coming to work every single day and helping people improve their health and wellness, but what really gets me excited is thinking about the outdoor fitness zone we built here in Lake Worth, Florida. It was the very first built in a regional park in the United States, and we serve hundreds of thousands of people.
Why do I get up in the morning to go to my work at the health department? It's to reach out to those who are most vulnerable, the young, the old, the minorities, those who are immigrants, those who are underinsured, those who are not insured. Because the reality is that many times that this is the group that's most vulnerable and often the time that's overlooked as it relates to providing health care. And it may seem as a small, insignificant group, but it's essential for us to realize that protection of one means protection of all.
We've discovered that 1 in 4 persons in Palm Beach County and elsewhere are going to be impacted adversely with mental health. And we wear this button because I am one of 4. I am one because 2 of my 3 daughters were diagnosed with mental health conditions that required such pain, agony, and tears, and we are looking for women to speak out and break the silence. It's time, it's needed, and that's the work of Boca Raton's Promise.
As a breast cancer survivor, I had a real passion for helping women that found themselves in that same situation and dealing with the difficulties of finding treatment. Also, at the same time, now I found that the senior population have similar needs. So my whole purpose of doing what I'm doing is to bring the hope and reach the life for someone else and just care for the one in front of me. And I believe that that is the power and the motivation in life. It is to make a difference on whoever is standing in front of us. And if we all can take that same approach, we can definitely make a difference in the world that we live in.
I'm Dr. David Weinstein, and I'm with University Urologists.
My name is Ron Giffler. I'm a pathologist who practices in South Florida, including Palm Beach County.
I'm Alan Pillersdorf. I'm a plastic surgeon, and I've been practicing in this community for 26 years.
I've been working with Project Access for at least 5 years, and I deal with the urological problems of their patients. That could be anything from prostate cancer, bladder cancer, to kidney stones, urinary infections.
As treasurer of the Florida Medical Association, I have heard very well of the great program of Project Access here in Palm Beach County. I must say it has a reputation throughout the state as being the premier program of its type, helping patients most in need and unable to otherwise provide for themselves the resources to get the medical care they need.
As soon as Project Access came to our community, I've been involved because it's important to give back to the people who live in Palm Beach County.
I got this letter some time ago from a patient who I had operated on. It was about 2 weeks after surgery, and this was a guy who had really been in dire straits. He had been financially and physically really beaten down. After the procedure, he was so happy, and it had really changed his life. It made me feel really good. It made me feel very warm, and it showed me what a difference that we can make, and that what I did, and I think what a lot of the doctors do here at Project Access, do for these people who desperately need this service.
Despite all the changes in healthcare, there are still many uninsured and underinsured patients desperately in need of care. Project Access is unique in its great degree of community participation. Doctors and other healthcare providers of all specialties volunteer their time and energy to help these patients. This is what organized medicine is all about. The Florida Medical Association salutes Palm Beach County in its efforts with Project Access.
I'm proud to be a part of Project Access. The women I help with reconstructive surgery basically would not have an avenue to have reconstruction without it. And I'm proud of the doctors of this community who give to Project Access without asking for money, because they're giving their time and their services. And I thank you all. You are the heroes. Thank you.
I'm Dr. William Kay, Palm Beach Diabetes and Endocrine Specialist.
My name's Alina Alonzo. I am the director at the Florida Department of Health in Palm Beach County.
My name is Gerald Robinson. I've been in South Florida since 1976. I'm a surgeon. Presently, I'm vice president of Boca Care, which is the physician network affiliated with Boca Raton Regional Hospital.
I am Tommy Scheckman, a pediatrician here in Palm Beach County with Pediatric Partners. I am also currently the president of the Florida chapter of the American Academy of Pediatrics.
My name is John Strauswimmer. I'm a Mohs surgeon with Dermatology Associates of the Palm Beaches.
We're a group of endocrinologists. We take care of metabolic diseases, mostly diabetes and thyroid disease.
My role as director is to steer our agency to improve the health and the lives of all the citizens in Palm Beach County.
Boca Care hires physicians and totally manages their practices. This gives the physicians the ability to just practice medicine, which they're trained to do.
I have been a pediatrician for the past 30 years. My practice is centered on the concept of the patient-centered medical home, and most recently we have started to integrate behavioral and mental health services within our practice.
My practice is limited to skin cancer surgery, and my mission is to make sure that everybody who has skin cancer, regardless of their ability to pay, can get their skin cancers treated early and efficiently.
I love what I do, and often what I do is so simple. Today I saw a lovely patient. She had a blood sugar of 200. She was very upset about it. I simply asked her, what did she eat for breakfast? She ate cereal, and she had a banana and a glass of orange juice, and her sugar was 200. We simply rearranged her diet a little bit. She came back a few weeks later. Her blood sugars were close to 100. She was happy, and I was happy. It made me feel good.
Now, today we're hearing a lot about revolution in politics and revolution in medicine, but really revolutions change one person at a time. And that reminds me of this little girl that I worked with along with her grandmother. And we ended up in an after-school program, and because of that after-school program, both she and the grandmother ended up losing weight, becoming more healthy, improving her school grades. And I think that because of that, she went off to graduate and lead a more productive life as a result of all these little changes that are really done one person at a time.
I've been an advocate of physicians' rights during my practicing years. I've always realized the struggles that they've had economically and financially in managing a practice, and I've always tried to do something about it.
I love what I do every day, from seeing patients in the exam room to partnering with their families. I've extended my passion into the community by becoming a strong child advocate. It is so important that children are looked at and taken care of, because having a healthy child will not only result in healthy families, but in a healthy community.
My real passion is for service to humanity. It started in high school washing dishes in a soup kitchen, and continued in college and medical school by taking care of people in a homeless shelter. As a Mohs surgeon, I'm able to cure people safely for skin cancer, both in our private settings here in America and overseas in Africa and in the Caribbean. What I care most about, and what really drives me, is to show to young people today, our future doctors, our future lawyers, our future accountants, to see that with whatever professional field you have, you can serve your fellow human beings if you have that love and you have the drive to learn a great skill to share with everybody.